when you check your time, you see it's exactly 5 minutes past the hour of 11. A very beautiful way to welcome you to the issues on IKD 106.1 FM. And of course, when we talk about the issues, we talk about matters that concerns our nation, our community, and of course, matters that concerns you and I. Every Thursday on the show, we talk exclusively and extensively about healthy conversations. Your health is important. Our health is important, and that is why we have General Hospital Ikorodu join us in the studio every Thursday to talk health matters. My name is Adebambo Opeyemi. I'll be your host for today, where we talk about this deadly disease called diabetes. The World Health Organization has said that several times. The World Health Organization have said diabetes is deadly, and of course, it's a chronic disease that every human should try as much as possible to avoid. This will be our conversation today, where we'll take a look, an in-depth look at this deadly disease called diabetes. With me in the studio, I have a consultant, and of course, he happens to be an endocrinologist who will be doing justice to the conversation. All of the facts about diabetes we will talk about today on the issues. Some myths as well will be our focus on the issues. So I ask you to stay tuned. You can also listen to us from anywhere all over the world via our website, which is www.ikd1061fm.ng. I'll go on a very short breather. When I return, the issues continues. Good morning. Welcome back to the issues on IKD 106.1 FM. Just like you heard from here, I told you today our major focus will be on the deadly disease called diabetes. And to do justice to that conversation is no other than a consultant endocrinologist from Ikorodu General Hospital, Dr. Matthew Inyoda. I say good morning to you, sir.
Yeah. Thank you for having me. It's a pleasure to be here. Good morning, listeners at home. In the next few minutes, we'll be discussing diabetes, and we'll educate you as to the menace of diabetes and ways to address it.
Oh, thank you so very much. That is the voice of Dr. Matthew. We have so much to talk about today, Dr. Matthew, because whether we like it or yes, this disease is deadly, and of course, it has taken a lot of lives, not just in Nigeria, but all over the world. But then we believe that there are ways at which we can prevent ourselves from this deadly disease called diabetes. So the first question I would ask you, when we say diabetes, what exactly is diabetes? How well can you define diabetes as a doctor?
Yeah. Thank you so much. It's really a pleasure to talk on diabetes. Diabetes is a very, very deadly disease. It's a multi-systemic disease. To diagnose diabetes or to define diabetes, right? Commonly, people talk of sugar being elevated, right? For us as doctors and endocrinologists, we know that sugar, there are so many sugars, right? So in the course of this discussion, I'll be interchangeably using the word sugar and glucose.
Okay.
Right, because when we talk of sugar being elevated as regards to diabetes, we're actually referring to glucose being elevated in the blood.
Wow.
Now, the definition of diabetes, simply, at least for our listeners at home, and the pleasure and the population that will be listening to us, right, we'll simply define it as a metabolic disorder of the body, in which there is deficiency or absolute deficiency or relative deficiency of something we call insulin in the body. Okay. And that is and then with association of glucose or sugar being elevated in the blood, and these have a far-reaching effect, right? So it's the basic definition or the basic disorder or the basic way we can actually define diabetes.
So diabetes could be said to be a disorder in the body system?
Yes, it is one of the various body disorders in the body system. Now, I've mentioned the term, or rather a word, insulin, right? I said either a deficiency in absolute terms or in relative terms of insulin, leading to elevated blood sugar. Right, and then of course with this elevated blood sugar, the various problems that arises with diabetes ensue. Now, it's important we understand what insulin is.
Okay.
Yeah, as it relates to the sugar in the blood in the body.
Okay.
Now, for you and I who don't have diabetes, right? Insulin is one hormone in the body that is produced by our uh, pancreas, right?
Okay.
Yes, there's a part of the body we call the pancreas. It's in the abdomen, right? It secretes what we call a hormone, insulin. Now, when we eat, right, the food we've eaten gets digested in the intestine, it gets absorbed into the blood, and the larger percentage of what we eat actually gets converted into sugar or
Mm.
glucose.
Mm.
Now, there are limits, there are normal values of glucose,
Mm.
right, which are expected to be in the body. With deficiency of insulin, like I mentioned in the definition,
Mm.
either in relative terms or in an absolute term, right? Either it's absolutely absent or it is relatively absent. Sugar starts going beyond its normal boundaries, meaning it goes beyond the range that is normal for every one of us. So when this occurs for a long time, glucose starts damaging the various parts of the body. It starts damaging the brain, the eyes, the heart, the kidneys, uh, the body system, the skin, the limbs, our legs, our hands. It's really a far-reaching disease.
Mm. Dr. Matthew, I want to ask you this question. When we talk about diabetes, do we have types of diabetes? Because I think somewhere sometimes ago I've heard of pre-diabetes, and I was wondering what exactly is pre-diabetes. Do we have types of diabetes? Because I think diabetes is just diabetes.
Yes. Well, first of all, diabetes. There are broadly, initially, there are
Okay.
two types of diabetes,
Okay.
right? There's diabetes mellitus, and then there's diabetes insipidus.
Wow.
Well, yes, I want to assume the one we are referring to here is diabetes mellitus.
Okay.
Yes, the diabetes mellitus is a situation where somebody is passing a lot of sugar in his urine, a lot of urine first, and that urine tastes sweet. So yes, so diabetes mellitus means it's sweet. Diabetes means something a siphon, meaning somebody is just passing water through a siphon, right? Now there's the other type of diabetes we call diabetes insipidus. Insipid means it is not sweet, right? So there's
Insipidus.
yes,
Okay.
something insipid,
Okay.
right? So such patients who pass a lot of urine in their pass a lot of urine, but then their urine is not sweet, right? So it's referred to as diabetes insipidus. Now we are not talking about that. That's a different kettle entirely.
Entirely, I agree.
Right. So the common one we talk about usually that people are aware of is diabetes mellitus.
Mellitus.
So we'll be using the term diabetes freely to mean diabetes mellitus.
True.
Now to come back to your question of the types of diabetes.
Yes.
Yeah, there are, by the 2019 WHO classification.
Yes.
There are 5 categories of diabetes.
Wow.
Right. So I'll come back to the pre. Diabetes hybrid form. We call them hybrid forms of diabetes.
Okay.
Right. The 5th now diabetes from other causes. So many other categories. There are so many conditions that have been put in one group that we call other form. Pre-diabetes.
Okay.
Yeah.
Before the major diabetes itself.
Exactly.
Okay.
Now, to define diabetes or to say someone has diabetes, in addition to the symptoms the patient will present with, I think we'll come to that subsequently.
Definitely.
Right. The blood glucose values, or rather the blood sugar values, are cardinal to making the diagnosis. So if the blood glucose is there are values below the diagnostic criteria that suggest someone has pre-diabetes. Now, the good thing in pre-diabetes, right, is the fact that it can actually be reversed. Yes, so for someone who is in the state of pre-diabetes, there are things we can do to reverse it. I think when we get to treatment and prevention and management, we may talk a little more about that, because it will really also help in even those that have diabetes. So again, when we talk of pre-diabetes, it's actually seen in patients who is a situation that occurs in those who have type 2 diabetes. Right, not for the various other forms of diabetes. Right, so pre-diabetes is actually defined usually in patients who have type 2 diabetes.
What age category can one start saying, let me start getting worried of not having diabetes? Is it a disease that occurs in the old alone, or the aged persons, or it occurs even amongst children or the youths or teenagers?
Very good, thank you. Very, very important question. Yeah, well, that will just take me to discuss the burden of diabetes.
Okay.
Yeah, in the society. Now, world over, from the IDF Atlas, that's in the International Diabetes Federation Atlas of 2021, which is an atlas we refer to. It gives a holistic approach to the numbers and the individuals that are at risk of diabetes. So the IDF 2021, okay, IDF updates their data every 2 years. So we expect the 2023 data in the next few couple of weeks or months, right? But then the current one, which is the 2021 data we use, projected the world the total number of people living in the world with diabetes to be at 573 million the world over. Now, it's also projected that in 2045, by 2045, that is give or take about 20 years from now, right, the world population of people living with diabetes will be about 738 million. So that's about 40% increment in less than 20 years. Now let's come down to sub-Saharan Africa, right? The data said suggested that 24 million, right, of people living in sub-Saharan Africa, where Nigeria also belongs, are living with diabetes as at 2021, and projected that by 2045 we'll have about 55 million people living with it. So that is more than 100% increment of the number of people that are projected to, of course, with the increasing in population and all that. Now come down to Nigeria, right? About the current prevalence of diabetes is about 5.7%. Now we know we're still awaiting the 2023 census.
True.
Right. So being given a modest value of total population of Nigerians at 200 million, right? Doing the little maths will put us at minimum of about 12 million people living with diabetes.
Wow.
In Nigeria. Now,
12 million people.
Yes, minimum. Of course, just using a modest number for our population to be 200 million. We know we are actually far beyond that.
Far more than.
Yes. So, so now that come down to Lagos State. The current population of Lagos is taken to be about 15 million, and the prevalence of diabetes in Lagos State is taken to be at about 7%. Now, if we do that math, it will put every 1 in 15 persons to be diabetic. It means every 1 in 15. If we do the maths, every 1 in 15 persons you come across are likely to have diabetes or be diabetic. Wow. So that is a very huge body. Now, Ikorodu, yes, let's come home now to Ikorodu.
Yes.
It's the population of Ikorodu as at 2023, from my little work, showed that we are just a little above 1 million, maybe about 1.1, 1.2 million, right? So if we do that math, though we don't have a prevalence for diabetes in Ikorodu yet, right? I think now of course, this is an opportunity to also do a lot of work and see what the disease burden is, right? So we may have data by and by, but we know that every 1 in 15 persons you see, even in Ikorodu, right? This Ikorodu is in Lagos State.
Yes.
So are likely to be diabetic. So
Wow.
that is a huge burden. Now coming down to answer your question as to the age distribution
exactly
of diabetes. Yes, the types of diabetes also has a way of modifying who has diabetes. The type 1 diabetes is usually seen in younger individuals. In fact, as young as a neonate, meaning a newborn baby.
A newborn baby.
Yes, can actually have diabetes.
A newborn baby.
Yes, please.
Wow.
A newborn baby can have diabetes. An adult can have diabetes. A woman can have diabetes. A man can have diabetes.
So no one is actually exempted from having.
No one is exempted. So
wow.
but the types may vary. We see more of type 1 diabetes in younger individuals, children and adolescents, while for type 2 is seen in more adults and more elderly individuals. People who are above 35, 40 are more likely to have type 1 diabetes. But however, it doesn't preclude an adult person from having type 1 diabetes, as well as having a child with type 2 diabetes, which is even the more concern now. We are seeing our youths, our young ones, our adolescents, people in the adolescent age coming down with diabetes. And that has been linked with the lifestyle, right? The more our lives are being westernized in terms of what we eat, right? We eat a lot of energy-packed foods, right? Flour-based, fatty foods, right? And then we gain weight and we sit a lot, right? A lot of sedentary lifestyle, and of course, alcohol use is also very rampant. So people gain weight, and then that predisposes them to developing diabetes, especially among adolescents. Now, again, already age we know can be responsible for type 2 diabetes, but type 2 is now being seen among younger individuals. So which
originally is not supposed to be.
Exactly. Which ordinarily we wouldn't expect it to be. So meaning it's adding to the burden of diabetes among younger individuals, and then it's talking to the projection of 2045. If you remember the initial data I churned out,
yes,
right? So that will be what we're fueling the data of 2045. Now, the other aspect that is even scary is the fact that a lot of people don't even know they have diabetes, right? From various studies and research, we found out that for every one patient you are that is on medication or treatment for diabetes, there's another one out there that doesn't even know, right? And we know, as the discussion goes by and by, we'll discuss the various complications, and really they are scary. So it's actually better to prevent than allow those individuals get diabetes, and of course try to treat them.
Okay, Dr. Matthew, I want to say thank you. But then, with what you just said, no doubt, an ordinary man, when we hear the word diabetes, the first thing that comes across our mind is that sugar, excess sugar in the body system. That is the first thing that we want to think of. But then I will ask you, as a doctor with your wealth of experience in this field, is it sufficient to say that the causes for diabetes is only sugar? What else are the causes? Some of these causes, I would like us to talk at length about the causes of diabetes. What we know is sugar and diabetes are 5 and 6. That's all.
Yeah, thank you so much. Very, very important question. Yeah, sugar does not directly cause diabetes.
Okay.
No, it doesn't. The fact that you take sugar wouldn't be the cause of diabetes, but it will be a reason to indirectly cause diabetes. How do I mean? For an individual that takes a large amount of calorie-packed foods. What do I mean by calorie-packed foods?
Yes, please.
Foods that have refined sugars in them, right? Like the various fizzy drinks around, right? I wouldn't want to mention names.
Yes.
You have, of course, fizzy drinks, energy-packed foods from various
mostly in cans.
Yes, canned foods, yes, bottled foods, right? A lot of them are energy packed, right? So that can lead to weight gain, right? With weight gain, that there's the relationship between weight gain and diabetes, especially the commoner diabetes, which is type 2 diabetes, right, is being established. With increase in weight, the tendency to develop diabetes also increases. And of course, even by science, we know that there are reasons to develop diabetes just by weight gain. So one of the risk factors, so the link between sugar and diabetes first, I told you is indirect,
Yes.
right? So it can cause weight gain and lead to diabetes. Now the various other foods we eat that also lead to weight gain lead to diabetes. Now by our age, by aging, right, the tendency to develop the type 2 diabetes also increases. Now westernization of our lives now in various forms. We have remote control. In fact, I saw a video of a car driving itself to its owner. Right? There's a Mercedes Benz. The guy was at the car park. He didn't need to walk to the car.
The car had to come.
Yes. So that is also reducing the need to walk around. Right? Things that make us sit too tight in one position, right? Instead of walking to the car, he will have used some energy, and then that will of course will have helped him in losing weight.
So even the development of technology sometimes could be a problem.
It is a problem. It is a problem. We have remote controls. Initially, we walk to the TV to our sets to control them. Now we have to control it. We can sit, so someone can sit down for hours watching various movies
without
having to take a step, and at the same time taking popcorn and some other.
We even have robots now that works as slaves in the house.
Exactly.
Get me this, get me that.
Exactly. So in fact, the sedentary lifestyle, right, westernization of our life is a topical issue now as a major cause of cardiovascular disease. Right, which it does via via diabetes, the route of diabetes. So that is one. Then there are genetic factors, right, that are risk factors to developing diabetes. Now, if a twin has diabetes, there's a very high chance of the other twin developing diabetes too.
So diabetes could be hereditary.
Exactly, it could be hereditary. So you could inherit it from the father or from the mother. It's even more dangerous if it is inherited from the father. Now, if both parents are diabetic, now it puts that individual at even a higher pedestal to developing diabetes. If someone has risk factor to develop diabetes, meaning a strong history of developing diabetes, maybe dad or the mom has diabetes, and he doesn't live the lifestyle that will predispose him to developing diabetes, meaning these sedentary lifestyles, the ingestion of very high calorie packed foods, right? The risk of developing diabetes, even if he will develop diabetes, he will develop it at a very later age, right? And of course, at that time, there may not be any. It's still important that someone lives to old age, yes, in good health.
But then, to some extent, he feels I have lived well enough.
I've lived this life well enough, and then it may not be so badly. The control may not be difficult, really, even at that time. Little exercise and some one or two medications may be enough to address it, and the various chronic complications of diabetes may actually be put at bay if such an individual that has a risk lives a lifestyle that does not predispose him to developing diabetes.
So this has gone beyond the mindset that sugar is the only major risk factor that brings about diabetes in human.
Yeah. So genetic predisposition is there, and then the environment. So and they have an interplay. Right. They have an interplay. Yeah. So.
All right, thank you so very much. We might take in some calls if you have questions at all to ask Dr. Matthew from Ikorodu General Hospital. And today we are talking about the deadly disease called diabetes. It is very deadly. You might want to ask how deadly. You don't want to know. I must tell you, you don't want to know. So now, I would like for us to talk about some of the ways at which we could. You've talked about the causes well enough. I want us to talk about some of the ways at which we could prevent diabetes, because we should It's
Yes.
important for us to prevent diabetes.
Yes. Thank you.
Yes.
I was thinking, I'll come to your question of how
Okay.
to prevent.
Yes.
Yes. But how do we know we have diabetes?
Okay.
Right? How do we know? I said 50% of people may not even know they have diabetes.
Mm.
Right? So now, if someone has a relative that has diabetes, meaning a first degree relative, a sister, a sibling, or a brother, right, or the parents are diabetic, he should actually screen himself for diabetes. That's for
Mm.
screening. Well, that will be part of the prevention.
Okay.
But how do we know if we have diabetes? The presenting complaints usually,
The
right?
signs.
Yeah, the symptoms and
The
signs.
symptoms, yes.
Yes, they present with someone will be passing a lot of urine, right?
Mm.
He may wake up at night to pass urine 4, 5, 6 times,
Mm.
as well as during the day. He may also be passing equal amount of urine, 3, 4, 5, 6 times, and then passing large volume of urine, right? Such an individual will be thirsty from time to time and ingesting large volume of water.
Mm.
They just keep drinking water and passing it. Some may actually pass as much as 5 to 6 liters of urine and drink equal amount.
Wow.
Yes, in a day. Meaning,
Wow.
this bag of sachet water,
Mm.
someone can finish half of it in a day. Just an individual.
That's
And
terrible.
yes. So, and as he's taking water, is passing out a lot of urine, he will also be losing weight. Weight loss. Someone you saw so big, looking to have been enjoying his life, suddenly he just continues to lose weight.
Mm.
That is one way they present. Another way is that such an individual may be taking a lot of food, may just be getting hungry from time to time, just hunger and
Mm.
eating large portions of food, right?
Getting
Despite
hungry and yet eating large portion of food.
yes, and he's also losing weight,
Wow.
right? Because most of what he eats, what he drinks, he passes out in urine.
You know, sustainability.
He couldn't really hold it on.
Mm.
So that is one other way. Then there could be blurry vision. The person may not be able to see clearly,
Mm.
right? There could be recurrent boils, right? You could have a boil here today, the next one it will heal after a few days,
Mm.
whether it takes medication or not. 2, 3 weeks down the line, it develops another boil on another part of the body.
Mm.
That may, whether with treatment or not, it may also heal. Another few days, so recurrent boils, right? All over the body.
The body.
Right? Yes, they may also be sweating excessively, right?
Mm.
And then, especially after food, someone just finished his meal and is sweating excessively.
Mm.
It may be a pointer to the fact that that individual has diabetes. Now, there may be pain in the legs, right? Tingling sensations, needle prick pains in the legs. These could also be signs of diabetes.
Mm.
Now, before I go further, I also want to maybe just take 1 or 2 steps back.
Yes, please.
Yes, especially for those that are passing a lot of urine, right?
Mm.
Especially men, right? We've had cases where patients goes to a chemist or a nearby medicine store and says, "Oh, I'm passing urine," and the person there just gives some medications and thinks, "Oh, this is diabetes," and gives medications for diabetes and leads to hypoglycemia, right? That is low sugar in the blood, in which the patient may even pass out, become unconscious, and if timely intervention, medical intervention is not taken, that individual may actually die.
Wow.
So, diagnosing diabetes is not something to be left to an individual to just feel, oh, they mentioned these things on the radio.
It should not be an assumption.
Exactly.
Because of what you've heard.
Exactly. It will be better if you have those symptoms, right? Please go to the hospital. Let a specialist, a doctor, review you, do some tests, and then confirm there's diabetes before commencement of medication. We know there are various causes why someone may pass a lot of urine, right? Especially in men.
In men.
Yes. There's the prostate that may be responsible for urinary frequency, passing frequent urination.
Because I was about saying that a lot of men out there will start getting scared. If you didn't say, they will just feel like, but I use the restroom a lot.
So caution here, it's very apt. It's not all urinary frequency. Not everyone that passes large amount of urine actually has diabetes. there are other causes of urinary frequency,
Mm.
right? One of them I already mentioned at the beginning of the program, diabetes insipidus.
Insipidus.
Yes, someone passes large amount of urine that is tasteless, that is insipid, right? It's another disease, it's another kettle
On
entirely.
its own, yes.
Yes, they only just share the name diabetes because the person is passing a lot of
Because
urine.
it has similar symptoms.
Exactly, but his own frequency is due to some other disease, and the treatments are entirely different.
And so for Opeyemi, who called in to make that easy for you, just like the doctor has said, visit the hospital, get tested. That is the best way. Don't do assumptions. Don't have the mindset that you have this disease when you are not sure you have it. So just visit the hospital and be sure. Okay, you want to know if it is okay to drink bitter leaf water. Okay, thank you. Thank you very much. So, doctor, please, let's attend to Amira, who asked the question, what kind of food should someone living with diabetes eat? And, of course, Sabeki, who said, is it okay to take bitter leaf water?
All right, thank you, Amira, for the question. I will believe you have diabetes from the question, and you're on medication, right? And so the questions as to the type of food to cure diabetes doesn't exist really, right? The diet you need is a balanced diet,
Okay.
right? It's a balanced diet that is less in refined sugars, right? There are the refined sugars. The sugar we know, right, is refined sugar.
Okay.
Right. So a diet that is off refined sugar, either you adding it directly to your meal or ones that have been hidden in the meal you are eating. So refined sugars should be off, right? Cholesterol leading diet should be off, right? And then there should be a lot of fiber. There are healthy oils too that could be in the diet, and then of course healthy proteins and the carbohydrates, right? So there's no diabetic diet as such. It is a healthy diet. Just from the foregoing, we've mentioned the fact that our life is changing, and then that is pushing us towards developing diabetes. We are getting sedentary, and we are taking a Western kind of lifestyle, and then it's pushing us to diabetes. So in terms of the diet, we should come back home and eat the traditional meal we have in Nigeria and even in Yoruba land.
Our own kind of meal.
Yes, they are far better. They have a lot of roughage in them, and then they are good for diabetes and for every one of us. So no single diet is a diabetic diet. A healthy, balanced diet is what a diabetic and every other individual should eat.
And so let's attend to Sabiki as well before we go ahead.
Yes, use of bitter leaf. Yes, the issue with bitter leaf is that there are a lot of chemicals in it. You may have been getting some benefits from bitter leaf, right? The challenge we have, I think, is a challenge to us all, and maybe call onto our trado medicine and other scientists to separate the various benefits in bitter leaf, identify the particular treatment each of those things can actually do, and then we use them as such.
Accordingly, yes.
Not to now put all things together in one whole kettle, right? There are things that are beneficial, and then other chemicals in it to also cause damage. So it will be advised you don't continue to drink bitter leaf water. Really.
Without a proper usage of it, just this assumption. Anyways, with your words, according to you, Dr. Matthew, you talked about the fact that 1 out of 15 persons is most likely to have diabetes, which is very threatening, I must tell you. And when we look at diabetes with the way you've said it, a lot of persons have the tendency, if care is not taken, to be affected by this deadly disease. So tell us, how then can we best prevent diabetes?
Yes. We can prevent diabetes, especially the type 2 diabetes. Now, the type 1 diabetes, yes, to an extent can also be prevented. I only mentioned them individually earlier, which is why we couldn't maybe delve into them properly. Type 1 diabetes is caused by autoimmune diseases. What do I mean autoimmune diseases? There are some diseases, we call them autoimmune because they fight the body. They are supposed to fight infections or fight any strange thing that comes into the body. But then the soldiers in the body, you see them now coming to fight the body itself. Sometimes they fight and destroy the pancreas and lead to diabetes. Now, that is what surrounds type 1 diabetes. Now, that is a little difficult to actually control, right? Because it's autoimmune. Now, the other causes of type 1 diabetes that we can actually address, right? It's been found that people who breastfeed, who give breast milk, right, are protected. There's protection from breast milk to babies in the first 6 months to 1 year or even longer, as against developing diabetes, especially type 1 diabetes. So individuals, you see again, a westernization of lifestyle is coming in now. The whites brought in use of formula feeds, which are cow milk based, right, into our diet, and we threw away breastfeeding. Now start having type 1 diabetes in our children. They also have a lot of type 1 diabetes with them, right? So they are also going back to now preach breast milk. So breast milk feeding is a way to prevent diabetes, especially type 1 diabetes. That is one. Two, infections also have a way of causing diabetes, right? If an infection occurs on the pancreas, it can damage it. Right, so when the pancreas is damaged by an infection, especially the beta cells that secrete insulin, when they die, then someone will develop diabetes. Right, alcoholism, right, can also lead to.
There is a question here on WhatsApp actually. So maybe for the fact that you've talked about alcohol, let's just do that straight. I was waiting till the dead end of the program. This person is saying, this person is asking, let me save the name, but the person is asking, is it all types of alcohol that can cause diabetes? I don't know. I think I have an answer to that question, but I don't want to answer.
All right, yeah, a very good one. Very good one. In fact, currently, as at I think is it January or February, there's a WHO document saying that even a single drop of alcohol, right, is not safe. Right, initially people used to say yes, some red wine types, right, say red wine, white wine, whatever wine, the various ways,
the spirits, the beers,
the various ones. Now the current WHO document is saying even a single drop, from the first drop you start having problems of diabetes. So irrespective of the type of alcohol, alcohol is alcohol. It's just the congeners, the various other things they put into it that differentiates one from the other. Alcohol is alcohol, either in beer, in whiskey, in brandy,
irrespective of the flavor,
irrespective of whatever flavor they've added to it. So any one of them can actually eventually lead to diabetes. It could damage the pancreas and of course lead to diabetes.
Yes, please go ahead with the preventions.
All right, so the prevention modalities. Yes, we have to exercise more, right? Yeah, there's for those who are in offices, executives, right, there's what they call ergonomics, right, where you sit for 30 minutes, 45 minutes, you stand up and stretch and walk around, right, for another 5, 10, 15 minutes and come back to continue your work, right? And then we have to move more, right? If we reflect back 100 years ago, 200 years ago, our forefathers had no cars. They trekked to the farm, right, and they trek back. Now we have a lot of cars, right, and then the tendency to be sedentary, either at work or in transit to work, right, is there. So if we can move more, meaning we exercise our bodies, right, we, in addition to someone will tell you, oh, I have a very busy schedule, my work self, I climb upstairs, I come down. Yes, that is good, but you also have to create some time to exercise that body.
Exercise is different from stress.
It's different from stress. The stress of your work is your work. Your exercise for your body is a different one. So it's expected that you exercise minimum 30 minutes per day.
Per day?
Yes. So as simple as brisk walking, right, is enough for 30 minutes consistently per day, right? So diet again is the other aspect. I've mentioned it. I can't overstate it as a way to prevent diabetes. So it will also help me talk a little about the pre-diabetes that I mentioned that can actually be reversed, right? If someone is at the stage of pre-diabetes and he loses weight, in terms of he actively loses weight, you know, I mentioned weight loss earlier, that diabetes can make someone lose weight, right? Now, that is an unintentional weight loss. But you can
Okay.
make effort for someone who is obese, who is fat. You can actually make effort to lose weight. That is a healthy weight loss.
Dr. Matthew, are you saying that there are tendencies of a fat person having diabetes even more than those that are not fat or chubby?
Exactly. Exactly.
Mm.
Exactly. You just you hit the nail on the head, really. For people who are obese or on the fat side or overweight, they have a higher tendency to develop diabetes than someone who is not obese or overweight. However, we've seen patients or individuals who are not obese with diabetes. We have quite a number. But of course, we have higher numbers of people who are fat and obese who are diabetic relative to those that are not. I mentioned that there are two major cardinal risks or reasons why people develop diabetes. There's hereditary aspect, right? And then of course there's the environmental aspect, and then there's an interplay between the two. So there are some people who have the genetics of developing diabetes that didn't actually um, gain weight, but some years down the line, you see them developing diabetes. They are not obese, they are not overweight, but they have diabetes because of the gene, which is very strong. Now, if someone has the gene to be diabetic, or rather to be overweight and of course develop diabetes, or to actually develop diabetes to have an issue, now lives a lifestyle that will predispose him to diabetes, it also makes it even stronger. Now, so ways to now prevent it now, irrespective whether you are predisposed to it or not, right, is to live a healthy life.
Live a healthy life.
Healthy life, what do I mean by that? It will mean that we exercise more, right? It will mean that we avoid energy packed foods. It will mean that we avoid alcohol, right, which is a major one here. So those are major cardinal areas in preventing diabetes.
Okay, thank you very much, Dr. Matthew. Unfortunately, time will not permit us to continue this conversation, but I would not let you go until you give us that word of advice as a doctor that you are, a trained one at that, Dr. Matthew Inyoda, a consultant, and of course, an endocrinologist from Ikorodu General Hospital. I see all of the calls. I sincerely apologize. It is okay for us to digest this conversation well. But if you have more questions, please, I give you the permission to go ahead, go to Ikorodu General Hospital and then ask of Dr. Matthew Inyoda. He would attend to you as a consultant. When you get there, tell them from IKD FM, the doors will be opened onto you. But doctor, when we look at diabetes, how can it be treated? We have people living with it already.
Yeah.
Then how can we treat it?
Yeah, thank you so much. Yes, diabetes, again, the baseline, right? The baseline is lifestyle changes. Like we've actually reiterated several times during this discourse, right? Lifestyle changes in terms of weight, right? In terms of exercise, in terms of the diet we eat, right? They are very important, which is even the first thing we use. We want someone to go through before even commencing medication, unless of course he presented at the stage where obviously he must be given medication. So lifestyle changes, they are almost always there. So in addition to this, there are medications. In fact, several medications are now available that can be used to manage diabetes. Now there are tablets that can be used, and then there are injections that can be used.
Okay.
Now, again, depending on the type of diabetes, for type 1 diabetes, we know they don't have insulin at all. Okay. So for them, they have to be given insulin. In which case, insulin it comes as an injection. There's no oral insulin here. At the point there was intranasal insulin that can be sniffed, but that didn't really see the light of day. So insulin has to be given for type 1 diabetic patients, and there are injections. Now, for type 2 diabetic, they may also require to be on insulin, right? Especially when they come in emergency, as diabetes may cause various hyperglycemic emergencies. So they will require insulin to address diabetes at that time. And even for type 2, later on during the course of the disease, they may get to a point where we know, right, that tablets may not work for them anymore or may not be sufficient. So they may also have to be on insulin, right, in addition to the tablets they are on. So at the background is that lifestyle change.
The lifestyle
Now,
change.
yes, in addition to that, the various medications that one can tailor to suit individual patients when they come. Well, that would mean that not one size actually fits all. Yes, so yeah.
Okay, let me interject you for the last time. I beg your pardon. Let me interject you. When you say that the disease diabetes can be managed, are you saying it cannot be totally cured? So when somebody has diabetes, then that means, like Yoruba will say, "Oti di baraku." Is that the point?
Yes, it's akin to that. However, there are some categories of patients who have diabetes that can actually be cured. Right? Yes, there are ways to risk stratify patients. You can stratify them as some patients that can actually be cured. But how do I mean? Patients who are obese, who are very, very, very obese, who are fat,
Yeah, fat.
right, and they have diabetes, right? They can undergo some surgical procedures that will remove a lot of the fat, because fat content in the body, especially around the trunk, has been linked to the risk of diabetes. So when they undergo liposuction and some other various surgeries, right, they can actually success stories have abound of patients who have undergone that and have been cured of diabetes. Now, patient selection is very key. It's not every patient that will fit into that category of patients that can undergo such surgeries. So it's not all patients. Yes. Yeah.
Thank you very much, Dr. Matthew Ayonda. Before you leave, in just 1 minute, your advice, your parting words as a doctor to all of our listeners.
Yes, my parting words. Yeah, diabetes is a very, very, very deadly disease. It is a very expensive disease to manage. So, and then because the complications are just too far-reaching. From the eyes, it could cause blindness. It could cause a stroke. Right? It could cause acute heart attack. It could cause the heart to fail. It could cause kidney failure. It is the commonest cause of what we call non-traumatic amputation. Right? It would be reason to cut somebody's leg. So you can imagine these various
very deadly
situations.
Deadly disease.
Someone who walks around meets the needs of his family, is able to do things, and then with diabetes,
all of a sudden
he loses one or two limbs. We've had patients losing both limbs because of diabetes. No road traffic accidents, just because of diabetes. So it means that the advice would be for individuals who have risk factors, meaning they have family members who are diabetic, to get checked, right, and live a healthy life. Right, so because the complications are quite expensive to manage. So prevention is actually the key.
Thank you so very much, Dr. Matthew Ayonda, consultant endocrinologist from Ikorodu General Hospital. This is how far we can have it today. Trust me, next week Thursday again we have a healthy conversation here at IKD 106.1 FM. My name remains the same, Adebambo Opayemi, urging you to have a healthy life, live healthy, do your exercises. Immediately after this program, I would have my first exercise for the day. God bless you, God bless Nigeria, and it's a bye from now.